Hey there guys! Today I'm diving into a topic that's often swept under the rug but is super important for men's health: penile implants. Let's break it down, starting with what they are. Penile implants are medical devices surgically placed into the penis to help men with erectile dysfunction achieve an erection. Which patients are candidates for penile implant surgery? Patients who have failed PDE5 inhibitors, such as Viagra or Cialis, or are not responding to injection therapy, patients who have experienced priapism, and patients with Peyronie's disease and erectile dysfunction. The most important is if you are suffering from ED without responding to oral medication or injection therapy, and you want sexual activity with penetration, a penile implant is one option for you. Now, there are two main types: inflatable and semi-rigid. Inflatable implants can be pumped up when needed and deflated after use. Semi-rigid, on the other hand, are always firm but can be bent into different positions. So, why consider a penile implant? First, they can be a game changer for men who haven't had success with other treatments like medication or therapy. They can also provide a more natural feeling erection compared to some other erectile dysfunction treatments. Plus, they're discreet. No one will know you have one unless you tell them. Visually, no one can tell you that you have a penile implant. You have to know that this is a surgical procedure. The natural erection is replaced by one that is mechanical. For inflatable implants, a pump located in the scrotum between the testicles is activated and pump up to move the fluid that is a sterile saline solution from the reservoir, located usually behind the abdominal muscles or in your pelvis, to the cylinders located in the penis so that you can get an erection. After sexual activity, another button on the pump system is pressed to move the fluid back to the reservoir, causing the erection to go down. Of course, like any medical procedure, there are risks involved. These can include infections, implant malfunctions, or even a loss of sensation in some cases. Let me explain in more detail the potential complications that you need to know before proceeding with a penile implant. Infection rate, up to 3%. We do everything to avoid infection: special genital cleaning and antibiotics before, during, and after the surgery. If you have a penile implant infection, the implant must be removed, and you wait up to 6 months before trying a new implant. Any sign of infection showing in your labs or your skin, even at the last minute before your surgery, will prompt us to postpone the operation until all infection parameters are under control. Diabetes. Your hemoglobin A1C must be less than 8%. If you have diabetes or a hemoglobin A1C level of 8% or higher, you are at increased risk of penile implant infection, up to 22%. Your surgery will be postponed until your sugar levels are under control. Rates of reoperation due to mechanical breakdown is up to 15%, which can happen at any moment during the first 10 years. You will need surgery to repair or replace a small piece of the implant, or sometimes all the implant needs to be replaced, increasing the risk of complications. The size of your penis will not increase with the penile prosthesis. During the surgery, penile length is measured, and the longest size possible is placed. Autoinflation is expected during the first 6 weeks after surgery. Due to swelling and inflammation, extra pressure is generated around the reservoir, and partial erection can happen. Most of the time, it does not need any exceptional management. Your penis will go back to its normal shape and appearance 3 months after surgery. In the first 6 weeks, there will be swelling, bruises, and inflammation, and it can take up to 3 months to return to a normal appearance in the genital area. Other complications. Urinary retention. You will be discharged home without a catheter. You must try to pass urine independently. If this is not possible, a Foley catheter will be placed for up to 5 days. Then, we will perform a trial of the void to make sure you can urinate on your own. Urinary retention is commonly observed in men with a neobladder, men with bladder dysfunction, and men with a history of BPH. If you persist with urinary retention, Foley could be placed back and evaluated by the voiding dysfunction doctors. Erosion occurs when the cylinders are exposed through the skin or urethra. If this is the case, your implant must be removed, and 6 months later, it can be replaced again. The main risk for erosion is having a radiation history. Corpora perforation. Due to the presence of significant corpora fibrosis, during dilatation to place the cylinders, the corpora can be disrupted and be exposed to the urethra or the perineum. During the surgery, if it is not possible to repair or the presence of fibrosis makes it more challenging to place the cylinder properly, increasing the possibility of further complications, it could be decided to leave one cylinder only, which is still functional to have erections for sexual activity. Glans necrosis is an emergency, and the device must be removed immediately. The distal circulation of the glands is suppressed. This is primarily observed in men with a history of diabetes and heavy smokers, and a malleable penile prosthesis was placed. Most patients report mild to moderate penile pain after surgery. Some patients can describe severe pain, which decreases in intensity after 3 weeks post-surgery. Most patients describe occasional penile pain up to 12 weeks post-surgery. However, some patients have reported penile pain lasting for several months, and in exceptional cases, the penile prosthesis was removed due to penile pain. If you have penile pain, this will be discussed with the surgeon so that further steps can be evaluated. Related to the reservoir placement, due to the reservoir being placed most of the time submuscular or in the retzius space through your inguinal channel, potential de novo inguinal hernia, as well as bladder, bowel, and vascular injury, has been reported, including bowel obstruction and bowel perforation, which would need surgery to resolve. Related to any surgery, potential side effects, including but not limited to surgery and anesthesia, are pain and discomfort. For most patients, this is mild to moderate and responds well to regular painkillers such as Tylenol plus Celebrex, constipation and difficulties with bowel movements, infection, bleeding, bruises and hematoma, cardiac complications and thromboembolic events, and death. It's crucial to have a thorough discussion with your doctor to weigh these risks against the potential benefits. Recovery time varies, but most men can resume regular activities within 4 to 6 weeks. It's essential to follow your doctor's post-surgery instructions carefully to ensure the best outcome. So, what's the takeaway? Penile implants are not for everyone, but they can offer a significant improvement in the quality of life for those who need them. Remember, it's all about making an informed decision that's right for you. Alright, that's a wrap for today's video. If you found this information helpful, make sure to like and subscribe for more content on men's health. Stay healthy, and I'll catch you in the next one.